Awesome. So welcome everyone to our Launching Peer Support Programs on College Campuses webinar. My name is Kelly Davis. I'm the Director of Peer Advocacy, Supports and Services in MHA's National Office, and really excited to be here with you all today about this very important topic with some really awesome presenters. Just a couple notes before we get started. You can use your microphone or speakers on your laptop or computer, or you have the option of calling in. If you have any questions or any tech difficulties during the presentation, feel free to type into the chat box and I can help you. And we'll also have other questions at the end of the presentation. And finally, the webinar will be recorded, and the slides and webinars will be available through MHA's website. So without further ado, I will introduce you to both of our presenters today. So today we have Bobby Dishell from the advisory team at the Support Network, and Stefanie Kaufman, who is the Executive Director of Project Let's. And I'll tell you a little bit more about each of them. So I'll swing it over to Bobby to get started. So Bobby is an advisor for the Support Network and is a student at the University of Colorado Law School in the Tax Emphasis program. Upon graduation, he hopes to work on public-private partnerships, real estate, public finance, or food law. Bobby co-founded the Wolverine Support Network during his time as the as the student body president at the University of Michigan. After his time at Michigan as a Teach for America core member, where he was a founding member of Happy Teacher Revolution and currently serves as an advisor. Bobby's passionate about mental health, peer support, urban gardening, and community development. Bobby's leadership and work have been featured in End Zone, a #6 New York Times bestselling book, The Wall Street Journal, ESPN, Education Week, Detroit Free Press, GQ, Forward, and other publications. So I will turn it over to Bobby to go ahead and get started.
Awesome. Thank you, Kelly. Can everyone hear me okay? Well, I guess, Kelly, can you hear me okay?
Yes, I can hear you.
Awesome. Thank you so much for having me on. So I mentioned my name is Bobby Dishell. I am an advisor of the Support Network. We are a all-volunteer nonprofit organization. We started with just Wolverine Support Network at the University of Michigan in 2014. There we go. So in 2014, we, after the suicide of a couple of students, we realized that there was a need on campus, that the #1 place students turned to was their friends, and that it was really getting in the way of their academics. So when we started at Michigan, we'll dive into a case study on Michigan in a little bit. We really leveraged the social capital that we were able to create. So we work with, kind of as an overview, we provide a handbook and good guidance to launch effective peer-to-peer support models for student leaders, and working hand-in-hand with administrators. So we currently exist on 3 university campuses and 1 high school campus, with at least 2 more campuses starting in the fall. We field interest from 1 to 4 campuses a week on average, and really focus on a responsible growth model to ensure that the best students and administrators are in place before launching and going full swing at a campus. We provide funding for our campuses, match funding for some of our campuses when you start out to host your first retreat, and provide continuing ongoing support as well as a network for students and administrators once they join. All right. So next slide. Cool. So in the fall of 18, we founded the Support Network as a national organization. We're really excited to be doing this work. And again, what we do is we provide weekly groups for students, 4 to 10 student members with 2 to 3 trained student leaders who are trained on peer facilitation, how to make a referral. Each week, those student leaders meet with a mental health professional from the university, often someone from their CAPS department who acts as an advisor. and that CAPS advisor provides training on how to facilitate conversations around issues surrounding mental health. Every Friday we bring, every other Friday or once a month, we bring the entire community and network together, as well as the student body at large. We really believe in the fact that mental health is something that impacts everyone every day. And so it's, again, providing peer support for individuals. And then these Friday events provide an alternative to a Friday night on a college campus, but also provide an opportunity for students to bring others who might kind of be willing to dip their toes in, but not really jump full in. Our weekly groups are the same week in and week out to build that level of trust and really build more of a community across campus. And then we also offer walk-in groups on our different campuses. So the power of students is really important to us. So here are kind of going over what the power of students are, undergraduate students as well, and the true power that exists there. We have on our advisory team a wealth of students who work in the mental health world, work in nonprofit, work in for-profit, or former JED mental health award winners, as well as serving on Mental Health America's advisory council. So we really bring people together from a cross-section who understand the difficulties and the nuances of working at the university level, as well as student advocacy. Oh, sweet. So this is our expansion process. We receive inbound students from students, administrators, sometimes parents, other stakeholders. We share our overview materials, hold intro calls to assess student and admin capacity. We share our expansion agreement, which ensures accountability and model integrity. Once that expansion agreement is signed, we provide the support network blueprint, which is kind of a comprehensive how-to, along with consultation to implement it on your specific campus, and work to empower and support our students and administrators towards a successful launch. The new director team, which is a team of 5 to 6 student leaders, joins our web-based portal, which includes each campus's director, our advisory team in order to help with inquiries, fully roll out the organization, how to receive funding, how to make an ask, along with just, we're having this issue, can you help us out? And then we collect data and insights from each campus and facilitate discussions around best practices, troubleshooting, and cross-campus coordination. So taking a quick case study at Wolverine Support Network at the University of Michigan, WSN seeks to address and promote student mental health and well-being through weekly peer-facilitated groups and bi-weekly community events. All of our campuses are founded on these same pillars and values of peer support, community, mental health and wellness, social capital, and the values of inclusivity, empathy, mindfulness, courage, accountability, and confidentiality. So you can see it's a sponsored student organization under Michigan CAPS. They receive campus support from SAPAC Sexual Assault Prevention and Awareness Center and a variety of other organizations on Michigan's campus, and then provide weekly group and kickback Fridays for its members as well as the Michigan community at large. The reason why we do weekly group is there's, again, barriers to mental health dialogue that are addressed by our model. So sociocultural stigmas. We provide confidential, accessible, and inclusive space that creates a new norm. We know that possibly going to a CAP center is really intimidating and a hard step for people, and it can often be more approachable going with a friend or going with your peers to a room or a building you more readily access, and also at a time when you're available, when it works for you. Financial costs. Our model is cost-free for all students. Our student leaders volunteer their time. And then timing and conveniences, like I mentioned, students select a consistent time and place on campus, and then we match them into groups to ensure that it's a fully, as well as we can, randomized group. So a few, go back. Great. A few milestones. We have over 1,000 students involved in Michigan with 63 total groups. The Michigan team has been invited to NASPA's Mental Health Strategy Conference in Portland, the Depression on College Campuses, Recode, which is a giant competition in Canada, and then developed a computer program to distribute members based on time and location preferences. Our leader training, we do an application interview process. They have an off-campus retreat where we learn facilitation skills, focus on different boundaries and handoffs. QPR training for making referrals. Different campus resources make presentations. We do group scenarios, role plays, and then ongoing question and answers with their peer initiatives coordinator, which is the title of the Michigan staff person, but really they provide ongoing support for our leaders. So impact on campus in the fall of 2017. 74% of students felt they are better equipped to take charge of their personal mental health and well-being. 76% felt they are better able to share sensitive topics with others. 65% felt they are better able to support others without additional emotional or physical strain to themselves. And 81% felt they are better able to understand and empathize with others. And we're currently working with some of our other campuses on their IRB process and things of that nature. So it's an area we're also well versed in. This is our advisory team. And then we also recently had Dr. Vic Schwartz join us as an advisor, who's the medical director for the JED Foundation. This is a select group of schools and colleges where administrators and students are interested in expanding. We would love to see any of your schools up there as well. Feel free to send us an email. And with that, I tried to make sure I left plenty of time for questions. With that, I'll give it back over to Kelly.
Awesome. Thanks so much, Bobby. That was great.
Yep.
And now we will switch it over to Stefanie. So I'll do an introduction, Stefanie will present, and then we'll have some time for questions. Again, if you have any questions, feel free to type them in the chat box and we'll go over them. So Stefanie Lynn Kaufman, pronounced she, they, is the Executive Director of Project Let's. They are a queer, disabled, autistic, and mentally ill community organizer and graduate from Brown University with 2 BAs in medical anthropology and contemplative study. In 2013, they founded Project Let's after the suicide of a friend and living with their own neurodivergent experiences. Stefanie approaches their work with various lived experience, including psychiatric and physical disability, sexual assault, and suicide, and from an anti-oppressive disability justice framework. They are invested in and committed to disrupting multiple systems which disproportionately discriminate, harm, and kill mentally ill and neurodivergent folks worldwide. Through Project Let's, they developed the Peer Mental Health Advocate Program. PMHAs are students who have lived experience of mental illness, trauma, disability, and/or neurodivergence, and work one-on-one with students in long-term peer support and advocacy partnerships. PMHAs are trained to assist students through the process of seeking adequate mental health care while remaining mindful of financial barriers, cultural barriers, and myriad of other factors that can prevent access to some forms of treatment. And with that, I will turn it over to Stefanie.
Awesome. Thank you so much, Kelly. I'm really excited to be presenting today. And thank you, Bobby, for your presentation on the support network. It's really great to be here. Next slide.
Oh, sorry. Let me turn it over to you really quickly.
No problem.
Sorry about that. Here we go. Okay.
Okay.
And if it's not working, you can just tell me to switch the slides, and we can just do it that way.
Okay, I think it is not working right now.
Okay. Okay.
So I will let you do that. Thank you,
Okay,
Kelly.
perfect.
Awesome. So as Kelly mentioned, I founded Project Let's. I'm currently the executive director. We founded as a nonprofit in 2013. And we're a national grassroots organization that is completely led by and for folks who have lived experience of mental illness, disability, trauma, neurodivergence. So we use all of these terms to be really inclusive to a variety of individuals who feel comfortable identifying with different labels and in different ways. So the primary work that we do is in establishing alternative peer-led communities outside of the traditional mental health care system, providing services of advocacy and peer support, peer counseling. We also provide resources and educational materials, and a big part of the work we do is aim to protect the civil and human rights of mentally ill folks through policy change, particularly those who are multiply marginalized and experience the intersection of multiple forms of oppression. So something for us that's really important is to take on a framework of identifying not just stigma, but also ableism and viewing our work through a lens of disability justice. So this is kind of one step outside of awareness. So for us, raising awareness about mental illnesses without really addressing health disparities, cultural differences, the inadequacy of certain mental health care treatments, and the professional stigma that can occur within the mental health care system is not enough. We really believe that to truly foster healing, we need to actively support individuals with mental illness by doing something concrete, increasing resources, creating these strong communities, and reforming existing policies. Next slide. Great. So this is a photo of some of our students from our chapter at Brown University giving a panel in the abnormal psychology class. And right now we're working with over 20 schools in the United States and Canada. Some of those schools include, as I mentioned, Brown, Dartmouth College, Cornell University, Columbia University, UCLA, Ithaca College, University of Florida, Bergen Community College. So we started out in the Ivy League community, but have expanded to a variety of colleges and also do some work with high schools as well. So as I mentioned, we started doing this work in 2013 after the suicide of one of my friends, and really noticing the lack of conversation among educational systems, primarily this fear of liability. If we address mental health issues, if we address suicide within school districts, it somehow becomes the fault of the school. And we really saw the need for these independent peer-led communities to really form and take place. And when I attended Brown, starting in 2013, I saw the need on college campuses even more following my own experience with an involuntary hospitalization and working with and meeting many students who had been involuntarily hospitalized, had issues with forced medical leave, literally being kicked off their campuses for the issues that they were dealing with, or students who were too afraid to communicate with counseling centers at the university for fear of confidentiality and what would happen. So I'll talk a bit more as the presentation goes on about how all of that informed the work we're doing today. Next slide. Awesome. So our core idea is pretty simple. We really believe that people who have lived experience with mental illness can offer a really specific, unique, culturally and socially relevant and accessible type of mental health care known as peer support. So this is kind of the same idea of what Bobby is talking about here. Peer support has been really growing as a concept, as a form of mental health care. There's a lot of awesome research on peer support about why it's useful and how it's useful. And our model here is a bit different. So we, as I mentioned, are completely led and run by folks who have lived experience. So we are not, while we operate on campuses, we are not part of a campus program, nor are we supervised or overseen by a university. So I'll talk a bit more as well about what that means for us and how we manage those types of challenges. Next slide. Awesome. So these 4 images are just an example of what we do on campuses outside of the Peer Mental Health Advocate Program, the PMHA program. We also have a chapter-based model. So on the top left, that's another example of a panel. We have students who facilitate panels on a variety of topics, supporting friends through crises, psychotic disorders, eating disorders, et cetera. And really just giving students a space to share their lived experience and respond to questions in a format that is different from a professional with a degree coming in and talking about working with patients who have eating disorders, which is definitely still valuable, but this is coming at it from a different perspective. The top right is an example of our nightly room that we have on some college campuses, where our trained PMHAs will staff a room full of art supplies, typically at night between the hours of 7 p.m. and 3 o'clock in the morning, giving students a place to go during those sometimes difficult night hours where they might feel like they don't have a place to turn on campus. The bottom left is an image from our failure confessional, where students, we really wanted to challenge this idea of like ultra positivity culture with this concept of like it's okay that people have failed, and we need to be able to talk about that. It happens. Sometimes people take longer to finish undergraduate, or they get rejected from job offers or don't get internships, and it's okay to own that and to really be able to support people through that. So we have students really submit their quote failures as submissions, and it's been a really successful event thus far. And the last image here is from our suicide prevention memorial. Every year, our chapters facilitate these memorials where we give students on campus a space to discuss folks that they've lost to suicide, their experiences, and we create these boards where students can leave notes and address their loved ones. And it's a really emotional event, but it's one of the best that our chapters do, and has provided a really amazing community for suicide loss survivors on our campuses. Sorry, next slide, Kelly. Awesome. Now I'm going to talk a bit about our background and history, what really caused us to make this program, and where we come from in terms of our thinking. Next slide. So for us, this concept of a social model of disability, if y'all have heard this term before, is really, really important in disability and disability studies. There are two major frameworks of thinking about disability, neurodivergence, mental health issues. One is this medical model of disability, and the other is a social model of disability. It's important to note that they both don't have to be so contrasting. It's okay to take parts of each model and kind of be somewhere on a spectrum of where you lie and where you fit in. But the social model of disability is really saying that it's not just neurochemical imbalances or all biological issues that are causing mental health issues and disability. It's actually in part social factors, oppression, discrimination, poverty, trauma that are exacerbating, causing mental health issues. For example, a lot of students that we work with actually cite like the stigma that they face, the struggles that they face because they are diagnosed a certain way as being more debilitating than the actual symptoms themselves. So as an example, I used a walker for a few years during my time at Brown, and for me, it was much more frustrating. I was disabled by my environment, by the lack of accessibility, by my buildings not being wheelchair accessible and having stairs. That's actually what disabled me more than the fact that I used a walker. So this can really apply as well to mental health issues, thinking about accessing accommodations, for example, is something that is so difficult for students to do. Accessing care is so hard to do, and that is oftentimes what disables us more. So this concept is really important for us, because if something has a social cause, then we don't just need to be looking at medical solutions. We can create social solutions that can really impact the struggles that students are facing on campuses. Next slide. So to kind of go with that, this is from a study done in 2009 on college students who had attempted suicide in the past, but had not done so in the last 12 months. And they were looking at what factors were really important in preventing a suicide attempt. So as you can see, the top responses are disappointing, hurting my family, hurting my friends, wanting to finish school, hopes for the future, support of my friends, even your pet is above a relationship with a mental health professional. So again, this is not to say that mental health professionals are completely useless. That's absolutely not the point. Many of our students, our PMHAs, are also seeking mental health care in the traditional system, have therapists, have psychiatrists. I myself utilize the traditional mental health care system as well. This is the real major point here, is that there are other ways to support folks. There are other factors that are really important in preventing a suicide attempt or helping folks who are struggling outside of just this professional care is really what we're honing in on here. Next slide. Also, something that was a big impetus for us on campus was noticing this major crisis in students who are leaving school, leaving university, outside of forced medical leave, things of that nature, which we'll talk about towards the end of my presentation. Something that was really startling was the statistic from a NAMI college report in 2012 talking about how 64% of students who no longer are in college left due to a mental health related reason. Next slide. Sorry, yeah. And what's really startling about that, 64% left, but only 23% came back. There is a huge gap of students who are being filtered out of university because of their mental health issues, and this really showed us that there is a huge lack of support. Perhaps it's academic, social, medical, a combination of all of those things on campuses that are really leading students to feel like they aren't able to manage, they're not adequately supported, and that was a really, really big problem for us. Next slide. So this quote is from one of our coordinators at Bergen Community College. He said, "Not only did I leave school, I also left school knowing that if I did come back, it would be even harder to begin with because I would have to retake everything and then I have to pay for it." So this is kind of tying into some of the issues with medical leave, that oftentimes if you're a lower income student or you have a particular set of academic goals or an academic plan, that a lot of schools are not as accommodating and as flexible within that, and it really creates a very difficult set of circumstances for students who might feel like they want or need a break from school, but feel that they're being penalized within that. So this was another really strong impetus for us to build this program. Next slide. So just thinking as well about why counseling centers exist and why they were started. One of the first folks who was really looking at this was actually Clifford Beers, who is really connected to Mental Health America, which is awesome. But he experienced abuse in an asylum and as a Yale student, and really called for departments of these like mental hygiene centers to be embedded within universities. But something that was really notable about the creation of these centers was that they were primarily created to, as the bottom bullet says, prevent suicides, breakdowns, and bad publicity. So this idea that the counseling centers are almost used as like a filtering process to identify students who had certain mental health issues, and make sure that they weren't necessarily on campus to lead to or trigger this like negative publicity. And on the right, there are just some like screenshots of different news articles that have come out over the last like I would say 6 years or so, about how colleges are really stopping depressed students from returning to campus, kicking students out, involuntarily hospitalizing them, and having being given like 24 hours to get their belongings from school. And again, I do want to state here that it's not this is not the experience of every student who will go to a counseling center. We absolutely refer students to counseling centers, but we also want to be really open and honest about what does happen and what can happen within these systems in order to prevent additional trauma from happening. And also, it's more common for multiply marginalized students who are at the intersection of multiple forms of oppression to be facing these more, quote, severe circumstances of forced medical leave and voluntary hospitalization. So we really do need to center those narratives within this conversation. So I'm definitely not trying to be like super negative and dissuade anyone from using their counseling centers. We just want students to really be aware and have agency and know what can happen and what their choices are. Next slide. We also started noticing this kind of like conflict of interest, I would say, of administrators. It's really started happening after the Virginia Tech college shooting, where schools were really building these threat assessment teams that like identify students who have who may be a danger to themselves or others. And what happens here is often that confidential information or information that students believe to be confidential can be shared among administrators and members of the university who are part of these intervention teams, assessment teams. Oftentimes, students might not even know that their university has this type of assessment team. So all of these things really led us to building a program that was not supervised by the university. So we go through a robust set of protocol and policies to ensure that our programs are managed well, managed adequately, follow our quality and our standards, but we do not allow universities to have access to our records of who is utilizing a peer counselor, why they're utilizing a peer counselor, and in that capacity we are confidential from the university, in part because we wanted students to trust us and trust that their information was not being shared in this type of capacity, which can be really harmful for student well-being. And I will also just say it is really not us versus the university. It's us versus the problem. This is something that we really believe it is possible to have university support for a program like Project Less. We founded this model at Brown, and we've had incredible support from the Counseling and Psychological Services Center, and the director of that center, Will Meek, has been incredibly supportive of the work that we are doing, and very much understands that this type of program needs to exist without university oversight to build that trust and relationship among students. So yeah, that's really important for us as well. Next slide. Great, so now I'm just going to talk a bit about what the model looks like. Next slide. This is an example of our page from Brown's PMHA site. You can scroll through and see the photos and bios of a lot of different PMHAs that we have. Next slide. Here's another screenshot from that. And it's really important, even this web page alone is super critical to have the ability to like go through and see the faces of other students at your university who are open about what they're dealing with, and reading their bios and seeing like, oh, this person deals with PTSD, or that's a person of color who deals with self-harm. And we allow students to choose, like request specific peer counselors that they'd like to work with. And we also don't require that any PMHA be put on the website if they're uncomfortable doing so, if their privacy it trumps wanting to kind of like be open in this capacity. But it is something that's really important for us to have pages like these at each university where people can really put a face or many different faces to all these different areas of lived experience has been a really important part of our program. Next slide. So as I mentioned, these peer mental health advocates, or PMHAs, offer one-on-one long-term mental health support. And the peer mental health advocate program really aims to address barriers that people face while seeking mental health care and provide them with a support system to break down those barriers. So our PMHAs go through an application process and are part of an 8-week training program, 2 hours per week, facilitated by the coordinators on their campus who are extensively trained and supported through our university. There's a pre-recorded webinar portion of each training done by our national team, and then there's in-person facilitation as well as group activities, a lot of dialogue and exercises to build that community on campus. And students are really diving into topics like listening skills, empathy, race, identity, sexuality, and how all of those things intersect with mental health and disability, crisis situation, understanding de-escalation skills, what to do in different crisis scenarios. Students learn how to make referrals, all the different resources on campus and in their communities, as well as the history of the disability rights movement, of peer support, and of mental health within specifically the United States, which is really critical for students to have this understanding of where did this all come from, this treatment. We talk about deinstitutionalization and how it's possible that some folks with mental illness end up in higher education and some end up in prison. And we have a really, again, an anti-oppressive disability justice framework that is really critical during our training. And we also do QPR training as well and dive into suicide prevention. Next slide. So some of the benefits of working with a PMHA, this is personalized one-on-one support. Students are, again, able to choose the identity of their peer counselor. One of the biggest issues that students have identified with counseling centers is this lack of representation. If you are a Black student, you might really want to work with a Black counselor. If you're a trans student, maybe you want a trans counselor, or you want to work with someone who has competent training in that area. And that's something that we've seen universities really identify in recent years and try to diversify and make their counseling staff more inclusive and representative of their student bodies. But it is really huge to have students be able to say, I only want to work with a woman of color who's queer, and be able to have that match. So it's free advocacy services. We do a lot of advocacy work with our students. We'll help them write emails to their professors. For me, when I was in college, I always say having accommodations and trying to get them with each professor that I had was like another full-time job. It was absolutely exhausting when I was a student. And I always wished I had a support to like help me write those emails, come with me to the course, and discuss with my professor, like, you know, I need a backup here. These are my accommodations and I'm legally entitled to them, and you actually are not legally entitled to ask me why I need them and like battle with me. So we show up to meetings with administrators, with disability centers, with professors, and we really help students advocate for what they want or need in a moment. We're also, depending on where you are, available when clinical care isn't. We've worked with a lot of students at 4 a.m. and stayed up with them until the counseling center opens and they're able to go. Or like I mentioned, our nightly room is available at night. So we are able to, with over 250 PMHAs, we're able to really provide a lot of services almost around the clock. It's not a requirement. Nobody takes a shift that they're uncomfortable with, for example, but by having such a large body of peer counselors, we're really able to be available when clinical care often isn't. And one of the things I think is most important to mention here is this equal partnership and transparency. Something I really struggled with in the mental health care system was constantly feeling like I was the inferior person in this relationship because I was the one who was sick or mentally ill or disabled, and I was seeking care from this healthy, neurotypical professional, and there's this power imbalance that was oftentimes fairly uncomfortable for me. So this relationship with PMHAs is all about equal partnerships, and we don't go and make decisions on behalf of our peers. We work with them so they can really feel empowered to have that agency and make decisions regarding their own care, which is really critical and important when dealing with an already marginalized and like at-risk population. Next slide. Cool. So what does working with the PMHA look like? So the peer and PMHA will collaboratively plan a meeting schedule. Oftentimes it's once a week, depending on their needs. It could be twice a week, in person. Some folks like to do phone calls, video calls, etc. And also there is often a dynamic of if a student is in crisis or needing more support, they can reach out to their PMHA or the chapter program, at any time. And we have our PMHAs work with their peers to set boundaries and say, like, listen, you know, I'm comfortable with you reaching out to me on weekdays, not weekends, or after 10 p.m. I can't respond to any messages. So it's a big part of the beginning of their relationship to set those boundaries and really identify what can work for the peer, for the PMHA. So some of the services PMHAs provide, we'll talk a lot about our lived experience as a means of building strength with the peer who may not have been ever able to openly discuss this with someone before. For a lot of students, this is the first time they have a peer who has a similar diagnosis or the same diagnosis or lived experience to them, to really talk about what it means to live with this illness and this experience. And that's a huge source of comfort for so many folks. We also help peers access resources, get appointments at CAPS, figure out what is available to them, what financial assistance could be available to them on campus to help them with off-campus therapy. We do a lot of that nitty-gritty back-end work, like what insurance your provider might take, or finding certain providers that take your insurance, et cetera. Like, that's a lot of difficult nitty-gritty work to do, especially if you're in the middle of like a mental health crisis. That's like the most difficult time to start doing all that kind of work. We'll also talk a lot about building coping skills and coping mechanisms to get through difficult moments and crisis moments. And building safety plans, crisis plans, that's a huge part of the work we do. And it's really self-directed by the peer. If they want resources on how to manage their OCD, we'll find them within our kind of resource library. If they want to connect with a counselor, that's what we'll prioritize. So it's very much directed and led by the peer. Next slide. Super important for us to mention is that PMHAs are not therapists. They do not assess or diagnose. They are educated folks with lived experience, and our PMHAs are trained really well to address this distinction by establishing those very clear boundaries with their peers. Next slide. So this is actually an example of a real conversation that happened between a peer and a PMHA. The peer messaged, I think I need to go to the hospital. And the PMHA responded, do you need me to bring you any food? What are the types of things you want the hospital to provide? Let me talk through our options here. We can work on makeshift short-term solutions that can get you to graduation. So this peer was actually in the spring semester of their senior year of college. We can get you to a hospital now. We can meet with the dean to discuss together what going to the hospital might look like. So this was a really wonderful conversation to see for all the reasons on the right-hand side. First of all, the PMHA remained calm. They weren't like, oh my God, like what happened? What's going on? Like, and freaked out and like escalated the situation. They also offered various options. They didn't force one on them. They didn't take that power and agency away from the peer in that moment. They asked what the peer wanted. Do you need food? Do you want to go to a dean? We can take you to the hospital. They also didn't assume that the person couldn't make decisions for themselves, which happens so often in this space. And they also address social factors primarily. So one of the major parts of our training is that when someone's in crisis, we look at HALT factors first. Hungry, angry, lonely, tired. You can address so much with just those 4 social factors. So these are things that our PMHAs are trained to identify and trained to support their peers through. Next slide. So it's important for me to address like liability. As I mentioned, we are not supervised by the university. We do have a pretty robust scale of supervision that comes from the national organization, our coordinators on each campus. But primarily we follow mandatory state and federal reporting requirements. So these are like the 3 scenarios that are critical for all of our PMHAs to recognize. And again, these are ongoing situations we don't report in the past. So for child abuse, for elderly abuse, and for imminent threat to self or other, which I'll dive into in 1 second. But we also fill out a crisis planning document with all peers in the program. And like just for transparency, this was formerly known as the non-negotiable document. And then we had a peer in our program be like, you know, non-negotiable, like that is kind of like mandated type of language, and I'm not comfortable with. So we changed it to crisis planning document. And we really ask in this document, every student has to fill it out in order to have a relationship with a peer counselor. We ask them to define and describe their type of crisis situation, what indicates that they're getting worse. We ask, are there any people or departments on campus that are not okay for the PMHA to contact in an emergency? If you tell me that you plan to kill yourself, what am I allowed to do? Who am I allowed to contact? And if you tell me you plan to hurt someone else, what am I allowed to do? Who can I contact? So we require that students answer these questions so that we don't go behind their back. We don't utilize resources that they're uncomfortable with. But also our PMHAs are not stuck in a moment. If they feel like they need to reach out for outside help, they are able to do so. Next slide. So something really important for us is a really holistic look at what imminent threat to self and other means. So we've noticed on college campuses specifically, because of this strong fear of liability, the intent portion, like thinking about suicide, becomes enough for someone to say, like, you need to go to the hospital. You don't have like rights in this situation anymore. And for us, it's really important that all 3 of these things need to be present: a plan, means, and intent. The person needs to be thinking about it actively, the intent. They need to have a plan, like how are they going to do it? And they need to have means, the ability to do it. And when all 3 of those things are present, then a PMHA can move forward with getting others involved. Next slide. So this is just an example of a hierarchy of support going from level 1 at the bottom to level 6 at the top. We never want our PMHAs to feel stuck with no resources or solutions available. So we cover this 6-tier crisis intervention system that starts with contacting your PMHA coordinator on campus, moving into contacting someone from the national organization, calling a crisis service or provider and providing a hypothetical scenario without you using the person's name, and going all the way up to in-person crisis response. And we always say 911 is the absolute last resource that we would want anybody to engage with. But we do recognize that communities have sometimes extremely limited resources. So we have a whole protocol as well if someone does call 911, what to do in that scenario. Next slide. So we also provide our PMHAs with a 60-page document that we have been working on for a few years, and we're actually publishing this year our crisis response guide, which covers absolutely every situation that you could find yourself in working with someone who experiences this type of lived experience, and that's been really helpful for our students. Next slide. As well as similar to what Bobby was saying, we have an implementation plan, a guidebook for our chapters that really cohesively covers how to set up your chapter, how to set up your program, and all the logistical information. Cool. Next slide. So I'm going to quickly run through a couple lessons that we've learned with managing the program. Next slide. So this is from a PMHA who went through our training. I realized the tendency I have to fault myself when a system failed to meet my needs. For example, blaming myself for bad experiences with therapists or little responsiveness in terms of accommodations from the university. Learning about the progress to be made in systems of mental health care has been a relief and definitely reframed my perception about my ability to be helped and supported through different services I've used in the past. Next slide. So this is from a peer who used the program. I'm no longer scared of entering places on campus that trigger me. Even just creating a safety plan has been really reassuring. I'm better at asking for help when I need it and knowing the language I need to talk about what I'm going through. Next slide. This is also from a peer who used the program. When I worked with my PMHA, I was better able to regulate my studies and manage myself. I was more conscious of the medical leave reapplication deadlines, therefore able to successfully submit to the university before the deadline. This was integral in me returning to Brown. So I was seeing a therapist. My PMHA was useful in pinpointing academic and emotional issues I had in the past at Brown and how to deal with those in the future. My PMHA also connected me with a student who successfully returned from leave, which was incredibly helpful. And next slide. This is a PMHA who applied, who was formerly a peer, which is actually one of our markers of success for us to see how many folks go from being a peer to applying as a PMHA. Having a PMHA to talk to who is much closer in age than a psychologist was really beneficial because they understood firsthand about the difficulties. It felt great to finally be able to talk to someone that I could consider a friend about my mental illness, particularly because I had never told anyone outside of my family. I really want to help others and guide them through college as my PMHA did for me. Next slide. Cool. So this is just a comparison at the top of our peers' pre-evaluation. We require them to fill out a pre-eval before they start working with the PMHA, and we take a post-eval at 6 months. So this study was done with over 150 peers from the Brown chapter. So you can see the changes in having a crisis plan built, their confidence in using university resources, and feeling as though their mental illness was interfering with their ability to function. And at the bottom are some statistics we're super proud to share. For example, 90% of the peers using the program report increase in their knowledge of and ability to utilize coping skills. 60% of students report increase in their quality of life. 65% report increase in their ability to manage self-destructive behaviors and suicidal thoughts, which is huge. 70% report feeling more confident in their ability to handle a crisis, and 60% report an increase in their help-seeking behaviors, which would mean contacting a therapist or a community resource, for example. Next slide. I also do want to address just quickly some of the issues that we face with administrators. This is one of the biggest barriers, I think, for students who are looking to build a program on their campus. There can be a lot of pushback from administrators. So it's important to kind of know that is like standard across the board. It's not you, it's not your school, it's like how the system is functioning. Administrative powers really often lie within the system, while activists often find their power by interrupting these systems. And next slide. So this is kind of just something that came from Know Your Nine, a sexual assault organization, just thinking about some of the factors that can prevent administrators of the university from supporting these types of programs, especially programs in the mental health space, suicide space. The first one, protecting the university's bottom line. Many universities are like finding themselves more cash-strapped than ever before, so fundraising is like a really important thing that they don't want to mess with, which can be a reason why you're receiving like pushback on campus, as well as protecting the reputation of the university, right? I showed you guys a couple of like newspaper headlines of students who were pushed out of their schools because like any like bad press can really affect perhaps the enrollment of new students or alumni donations. So universities really try to like steer away from anything that could cause like negative press, as well as like protecting the university from liability. It's like really simple. Universities do not want to be sued, and oftentimes if a student does kill themselves on campus, there have been a lot of lawsuits about whose responsibility it was to act and to know these things. So these are kind of just some of the like motivations that can come from university administrators. I've worked with some incredible administrators on campus who are with it, are supportive, and at the end of the day still reluctant to support these types of programs because of all these like aforementioned of issues that come up. Next slide. This is from an article in the Atlantic talking about how university students are like really coddled and like babies, and I just wanted to bring this up to say that oftentimes if you're receiving pushback on this front that like, you know, your students are coddled, or, you know, oh, students like they shouldn't use accommodations, they need to know what it's like in the real world, et cetera, et cetera. These are often coming from people who are really privileged, who lack experience as a marginalized person, who don't know what it's like to need these accommodations or need these types of supports on campus in order to get their education. So my advice is really to ignore anything that comes up in that capacity, and know that these programs are critical and super important, and these criticisms are happening all over the place. So just to kind of show some solidarity there if you're hearing that on your campus. Next slide. Almost done, y'all. I'm sorry. So just some quick things on what you can do on your campus. Next slide. This is coming from the Project Live's Day of Action. We did a Day of Action that we will be continuing into a larger campaign this spring. This upcoming fall. And we really had our chapters identify major issues on their campuses. So lack of transparency about funding and policy, discriminatory leave practices, professors denying accommodations, and limited crisis services. We had students hosting town halls, demonstrations on their campuses, really demanding that they be heard and listened to and change happen on their campus. So if this is something you're interested in, definitely get in touch, sign up for our newsletter, and you'll hear more about our campaign coming up this fall. But it's also something you can do on your campus, identifying some of the major needs and having demands for your school. Next slide. So I won't run through all of these because y'all will have these slides available to you. These are some common concerns about counseling centers, like long wait times, limited hours, having a really like short-term model that like if you need long-term care, you're often pushed out in the community. Next slide. Here are some like potential changes that could occur on your counseling centers. So pushing for increased funding for additional resources, diversifying your counseling staff, reevaluating the like unnecessary intake sessions that happen, launching more community education initiatives, providing opportunities for feedback. So I definitely recommend y'all to go back and look at the slides I'm about to go through, which have some like really awesome ideas for changes to make on your campus. Next slide. So here is just an overview of some issues, some common issues with medical leave, ranging from a mandated amount of time off. Students must stay gone for a year, for example. Involuntary leave, impacting your GPA, financial aid, etc. Next slide. So this is a copy of a part of the Bazelon Mental Health Law Center's policy and recommendations for medical leave. I highly recommend everyone take a look at it. Bazelon is a major leader in this space in developing policy and knowing what is legal and what is not for universities to be engaging with. So if you feel like your university has some like shady mental health policies in regards to medical leave, I would definitely identify, bring this policy to attention and take a look at it and see what lines up and what doesn't. Next slide. As I mentioned, there are often issues with academic accommodations on campus, students not being told that they can actually get accommodations. So like barriers to entry in the first place, and then a lack of enforcement. As many of you I'm sure know, professors at the end of the day have the ability to like say yes or no to your accommodation if they believe it impacts the class in a negative way or your education. So it's always a fight, even if you do have your accommodation. So these are some common challenges. Next slide. And just a quote from one of our students: "None of my teachers told me about getting incompletes or getting accommodations to be able to do things online." So we hear this a lot, that students actually are not aware that for their particular conditions they could have accommodations. So I'd recommend, if this is something that hits home for you, stopping by your disability center on campus and really inquiring about what you are entitled to. Next slide. So just some quick thoughts for professors. We also do a lot of training with professors to get them more aware of how to accept accommodations. We'd like professors to like really suppress their curiosity, so they don't need to know what disability you have, what mental health issue you have, just what accommodations you need. And oftentimes folks will press and ask for more information, but just knowing that you're not legally entitled or required to give that information out. Also, like zooming out, so working to understand that students have a lot more to worry about than just one class, that these accommodations are not unnecessary, but or not like unrealistic for the larger society, but something that is actually necessary in a lot of different capacities. And understanding the dynamics of their relationships. So it's really important to know that some students just might not want professors to really be aware of what's going on in their life. They're the one that's grading them. They might not be so comfortable sharing all that private information. So just knowing certain tips to share with faculty if you are struggling or maybe providing some type of training on your campus. Next slide. Yeah, so again, I recommend coming back and looking at these slides coming up. Some student advocacy initiatives that can be really helpful on campus. Something all of our chapters do in the beginning of their kind of like life on campus is conducting surveys and assessments to really hear about the campus climate and what's going on. And also definitely something that was important at Brown was adding this like evaluation of professors to include inclusivity and accommodation, not just like how like engaging is this professor, but like how accommodating are they as well. Next slide. So yeah, just some final thoughts, other initiatives that you can consider on campus. Food pantries, meal type exchanges, on-campus childcare, transportation supports, all of these things really tied to disability justice, mental health supports, having financial aid adjusted for students who need to take more than 4 years, for example. And as I mentioned, something that is really important, faculty training regarding accommodations, and also something we started at Brown, these like safer spaces after on and off-campus tragedies. So we had 1 year a few students who killed themselves on campus, and Project Let's hosted safe spaces with art supplies and therapy animals and food available for students who just didn't want to be alone and who like needed to process but did not want to do so as administrators. And I believe this is my last slide. Next slide. Yeah, so just some quick tips on outreach strategies. We see a lot of universities getting involved with language of like wellness and mental health, which is super important in its own right, but oftentimes leaves out students who actually have an illness or disability, which is it is different. It's specific programming for that. So we often will utilize diagnostic language in the descriptions of our programming to really be inclusive to students who have that lived experience. We also have a policy of at events like our suicide prevention memorial, for example, of not having university administrators allowed to attend these events for the specific reason if students don't feel comfortable sharing their narratives or being identified as someone who might have attempted suicide or had suicidal thoughts and being flagged as an at-risk student. So we also prioritize collaborating with identity-based communities who have a lot of intersections with mental health issues, as well as being really conscious of pushing the conversation forward. So there might be a lot of programming about depression or maybe eating disorders, but not so much about psychosis or schizophrenia, for example. So really thinking about how to be inclusive towards all types of mental health issues. Next slide. Great. So that is all for me. Thank y'all for listening. I know I just threw a lot of information at you, so feel free to go back and process and review slides and listen to the webinar again if it was a little overwhelming. But yeah, my contact information is there, and we're happy to at any time speak to folks about building one of our programs or building your own program on campus. So thank y'all so much.
Awesome. Thanks so much, Stefanie. And thank you, Bobby. So now we'll have some time for questions. So some time for questions. So one of the questions that we had was for Stefanie, and that was, what study was cited for the 23% of students return to post-secondary schooling?
So that study is NAMI's college report. I'm going to, hold on one second. Okay, so it's called College Students Speak from NAMI, and it was printed in 2012. So if you just type into Google NAMI College Students Speak or NAMI College Health Report 2012, you can find that statistic. I apologize for not citing that. Thank you for that question.
Thanks. Another question for Stefanie. So when students are on leaves of absence, there's a lot of times either explicitly or implicitly limitations on their contact with or like ability to be on campus. What are the relationships between folks who are on leaves with the PMHAs? Are they in contact with them when they're gone, or how does that typically work?
Yeah, so that's actually, it's a great question. Thank you for that. That was a major impetus for the program. We had so many students who were on leave who felt like their identity had been completely removed from them. And if you look at that, that graphic that I had shared towards the beginning of my presentation where we're talking about factors that prevent suicide, so many of them had to do with school, right? So what we've actually noticed is that school itself is a protective factor against suicide. Being part of a community, having a goal to work towards, all of those things are really helpful. And when a student then goes on leave, oftentimes they are cut off, they're disconnected. So many schools are like, have policies where you can't be on campus. You aren't allowed to like continue your affiliation with clubs. You get kind of like all of your privileges of being a student are revoked, which feels really wrong for us. And so students are able to maintain a strong connection with their PMHA through, if it's geographically possible, in-person meetings. A lot of our students will do Skype sessions or phone calls, end up visiting each other, but they still have complete access to the PMHA program. And often our PMHAs serve as a critical kind of like connector back to campus, reminding students about the deadlines for applications. We've actually had a few PMHAs write letters of support for students trying to come back from medical leave to help show that they have been seeking supports while they're gone, which has been helpful in students being readmitted. But yeah, it can be really, really isolating to be on leave and disconnected from your community. So we go out of our way. We send those students care packages as well and art supplies while they're gone. We really go out of our way to make sure that connection is still alive and well.
Awesome. Thanks. So next I have a question for Bobby, and that question is, what boundary issues have arisen in the group, and how have you attended to or training group leaders around that?
Sorry, can you repeat the question one more time?
Yeah. What boundary issues have arisen in the groups, and how have you attended to or are training group leaders around that boundaries issue?
So we really haven't had boundaries come up as an issue as much. It might be because of the way that our model works, in that there are 2 to 3 facilitators. You know you're meeting every week. You know that either every other Friday or one Friday a month you'll be together as a community. And I really appreciate Stefanie touching on that importance of having that wide community. The reason why I don't think boundaries come up is we explicitly do not provide advice. Similar with liability issues, again, they're not counselors. They're not there to provide advice. If there ever are boundary issues, we work with our local campuses on how to have conversations with those students. But more often than not, the conversation is with the leaders around the fact that you're holding space for people. You're not providing them as if you are a mental health professional.
Thanks, Bobby. So next question is for Stefanie. And Amy asks, we have moved away from the term mental illness as a way to prevent illness identity. I see that your program uses this term frequently. Does this resonate with the students you serve?
Thank you for this question. So it absolutely depends. I would say that's why we try and use diverse and inclusive language. It's a mouthful, but we are always saying mental illness, disability, trauma, and neurodivergence. That's kind of what we found to be the most inclusive. There are students who, as I said, identify maybe more with the medical model and find a lot of power in saying, I'm mentally ill, this is what I have this label, I have OCD. It feels good for them to have, to know that they are not like making it up or they're the only ones who experience this, but there's a classified set of experiences that other people have as well, and they have something that can kind of bring them into a community. So I'm autistic, and I find we teach about person first versus identity-based language in our training. Some people prefer to say, I have autism or I have schizophrenia. Some people prefer to say, I'm autistic, I'm schizophrenic. That's totally a personal choice that we encourage our PMHAs to ask. How do you identify? How are you comfortable identifying? We've also found it's definitely something that ties into cultural identity as well. So a lot of white students are much more comfortable saying, I'm mentally ill, I'm out loud, and I'm proud about it, versus students of color who might be much more resistant or hesitant to taking on another marginalization, right? They're already marginalized by their race, by their culture and ethnicity. So it's actually unsafe or dangerous or just unappealing to identify that way. Not for everyone, that's not a generalization, but it definitely comes up where students prefer the more general language of just mental health issues. Neurodivergence and disability tend to be for folks who are more in line with that social model of disability and that type of framework. And then trauma more kind of like indicating that you've been through something that you're not comfortable pathologizing. So I also have been diagnosed with PTSD from a sexual assault experience. I do say I have PTSD, but I also feel more comfortable identifying with like having been through trauma because I don't believe that like something is really wrong with me. I believe my body is responding in an appropriate way to something wrong that happened to me. So I'd say it's a really personal decision. We do find the term mental illness to be empowering for a lot of students, however.
Awesome. Thanks, Stephanie. I hear that come up a lot as well. It's a big topic in our field. So the next one is for both of you. So you both acknowledged in varying ways the importance of engagement with administrators and counseling centers. So do you all have any tips for folks in working alongside and engaging administrators and counseling centers at the schools? Because that's something that a lot of students report just kind of being stopped immediately when trying to do this sort of work.
Yeah, it is one of the, we get inbound from administrators and from students, and when we get inbound from administrators, oftentimes one of the biggest challenges is they struggle to be able to find students due to the natural barrier that exists, and when we get inbound from students, one of the hardest things they report is being able to work with and build that relationship with administrators. And I love, and Stefanie, first and foremost, thank you for sharing your story as well as your great presentation. For us, we work directly with students and administrators and also coach our students on how to have conversations, right? And really weed out what is the root issue. Is the root issue liability? And if so, we work with our campuses on, okay, well, what do we need to set up for this group to be able to function at a high level? If it is funding, we say, okay, great. Well, this program is actually no cost. We can build our model so that it's not at a high cost to you guys. And we can also talk about fundraising and working with our campuses on fundraising. We've worked with some campuses to have 3/4 of a program be endowed, to other campuses who are working on a month by month. Hey, we need help just getting set up. So really it's about, again, utilizing that facilitation, that peer. And then another thing we're able to do is, now that we're at more campuses, is refer that administrator who's iffy about what's happening to other administrators who are helping us on our other campuses. I think the beauty of our program and our model is that your average student probably doesn't know the involvement of an administrative level, but they're able to provide liability protection. They're able to provide training and really help guide our students on our different campuses. So it's something I would say I probably work and email with administrators several times a week. In our different campuses, all of our director teams meet with their administrators regularly. But sometimes it's hard. It is not easy. And if I had stopped the first time we were told no, I don't think our organization would exist. And I'm sure the same is true for Stefanie and for so many others. So another one is persistence. And understanding the way that social capital works, not only for students, but also for administrators, and who can you find and meet with as allies in order to help push to get to where you need to be.
Yeah, I agree with so much of that. Thank you for that, Bobby. And you're totally right. If we'd stopped the first time we heard no, nothing would have happened. I think this idea of social capital is really important. We talk a lot about why do some students feel like more empowered to create waves in their university and disrupt and challenge administrators and others. And I think it comes a lot back to privilege. We've worked with a lot of students who are, for example, first-gen students who are receiving big scholarships from the university or financial aid, who talk about feeling really indebted to the university, and they don't feel like they can just walk up into a meeting with an administrator and be like, these are my rights, and you need to abide by them. It's this sense of this power imbalance, right? So we found it really helpful to build coalition and to really identify students who have this privilege and this social capital, and who do feel comfortable with that challenge, and protecting students who don't feel as comfortable with that direct engagement, but who still want to be part of the fight, so to speak. I think that persistence, as Bobby mentioned, is huge. We actually originally wanted to build the peer mental health advocate program into the university, and we worked on that for a while. And when we got shut down, and eventually due to just the university being like, oh, like with liability issues, et cetera, we were like, you know what, we're gonna push forward. We're just gonna do this on our own. We'd love your support. We're not doing anything illegal. Like, we have all of our liability guards and our training and our safeguards in place. But this is critically important, and we're going to just push forward and do everything through the student body. So I think we have more power than we believe, and we have more options than we believe. And I would say you don't always need to wait for that like golden stamp of approval from administrators. If you wait for that, you might never get it. And I'd say also one of the biggest things is to utilize like traditional organizing tactics. Like, do some research about what has happened at your university. How have marginalized groups and oppressed groups traditionally fought for their rights on campus? Have they done sit-ins? Have they done releasing demands? Have they occupied buildings? Have they stood outside of the president's office with a microphone and shared student narratives? I think we're really afraid in the mental health space to go there and to like adopt those strategies and practices. But I think it's critical to do so and to realize that that this is happening all over the country. Not to feel so beaten down and small if you're receiving no support at your university. Try reaching out to organizations like the Support Network, to Project Lex, to other groups who are doing this work every day and can really mentor you through this process and show you that there is a light at the end of the tunnel. It doesn't have to be so like depressing to keep working with administrators.
Thanks. And relatedly, what are important offices and student groups to work alongside, and any information you can share about, who's important or who's a good person or who are good people to get involved with, and some tips on maybe what has worked for your programs for building those relationships across departments and student groups.
First, I mean, everyone in every student group is critical. And at the end of the day, you're not going to get it right the first time. As Stefanie mentioned, we tend to work with people in positions who have that social capital. So when we launched in Michigan, we made sure to bring together the student body president and NCAA athletes and people who are a part of major organizations who normally get pressed in the student paper in order to continue to drum up support that way. In doing that, we ended up leaving out a lot of groups that were already marginalized and since have had to do a lot of work going back and trying to repair that relationship, which is now repaired and fine. But it is important to recognize that it's a tricky balance in organizing across the board. And so for us, we find oftentimes just student groups that are large and are well organized tend to be really great places to start on the student front, as well as student organizations that have relationships with administrators or faculty. Because oftentimes a faculty member or a individual is more receptive to their peers than they are from a group of students. But even more so, for us really building across campus, it's about how do we target our major organizations, as well as our identity-affiliated organizations to have a successful launch, but also make sure that our marginalized groups are not feeling tokenized and are not feeling like they are there for optical reasons, but really that they are a part of the process and welcoming people into that fold, which I know is how to do that, and the way in which that is done is beyond, maybe not beyond the scope of this call, but beyond the scope that I have time for today. Maybe Stefanie can touch on it better. But I think that's really what it is, and a lot of it is not being afraid to just reach out and say, hey, can you get a cup of coffee? I want to talk to you about this idea, or do you want to go for a walk? And being willing to be vulnerable, which is incredibly challenging, but it's amazing how receptive people are and how much and often people want to help. And the big reason why the support network got started was we started talking more and more about it. And we realized that everyone was willing to talk one-on-one, but people were looking for that community.
Awesome.
Yeah, I definitely agree. Thank you for that response, Bobby. And I think, yeah, one of the critical things you mentioned is not like tokenizing marginalized groups. I think one of the best ways to address this issue from the get-go is making sure that your group, your initiative, your coalition, whatever it is that you're working on, is inclusive from the get-go, right? Like, you don't want to just have a bunch of white students, a bunch of straight white students who then go out and outreach to all these different groups. It's much better to like build your coalition, your group, having a bunch of inclusive identities, because then that outreach can happen much more naturally. People will outreach to their communities that they're connected to and bring in folks that in a more natural way. And even to do that outreach, I think one of the biggest things is being open to feedback and changing what you're doing a bit. So like asking these groups, not just saying like, hey, this is what we're doing, we need your support, but asking like, how can this be helpful to you and your goals? Like, what do you need? What do you want out of this? What do you need to feel supported? So when we were working with some groups on campus, primarily students of color and Black student groups, were saying, you know what, to feel supportive, we actually want to address this fact that when students are having mental health crises, like DPS, like the Department of Public Safety, shows up to your dorm room. Like, essentially police show up with a gun in their pocket. And that's like incredibly traumatizing for so many students, but especially students of color and Black students who have historical and very real and big reasons to feel threatened and extremely fearful of that dynamic on campus. So even though maybe that's not an issue that everybody is going to deal with, like having a psychotic episode and a cop shows up at your door, that's something that is really, really important to certain folks and certain groups. And it became a critical part of our platform and something that we're fighting for. So I think being really open to changing the focuses of what you're doing, asking people not just for their support, but what you can build to include them in your work as well, and utilizing different groups on campus. We were constantly in communication with FCs, so that's Browns, like Disability Services, the Counseling Center, the Office of Student Life, and we have like share advocates on campus, which were like confidential sexual assault advocates as well. So making sure to hear out multiple perspectives and do the work to show up for other groups' events and their initiatives as well, because so much of it is really interconnected. So yeah, I agree. It's definitely a bigger topic than we have space for right now, but I'm happy to keep chatting about those tactics at any time as well.
Great. Awesome. So we have one more question, and that is, are there stats on your programs and their impact on graduation rates?
We have not directly run those numbers, but building on Stefanie's point, I think that's great feedback and something that we should certainly start looking into.
Yeah, as well, we are within the next year able to start identifying those numbers through our program, and having built up enough students who have gone through a few years of using a peer counselor now will be going towards graduation. That's a critical number for us to look at, and we definitely are very interested in identifying it, and will be doing so in the future. So thank you for that question.
Perfect. All right. It looks like we are at about time. Thank you both so much for your awesome presentations and for asking or answering everyone's questions. Just a reminder that the webinar is being recorded, and the recording and the slides will be available through MHA's website. Stefanie and Bobby's information is available through the slides. Feel free to reach out to them directly through the support network and Project Let's if you're interested in learning more. Additionally, at MHA, I created our Collegiate Mental Health Innovation Council that's made up of student leaders from across the country who are filling gaps in traditional services on their campuses. We put out a report in the fall that highlights peer support programs, the rationale for them, and then some of the rationale, research, and programs around disability support and technology on college campuses. So if you haven't seen that and you're interested in these topics, please check that out through MHA's website. And with that, I will close us out. Thank you all so much for joining us, and please feel free to reach out with any questions, comments, ideas, or anything. Have an awesome day, everyone.